Welcome to the beautiful Valle de Bravo. I had to look down at my notes so I would pronounce it correctly. I'm Dr. Nathan Goodyear, of course, Medical Director at Brio Medical in Scottsdale, Arizona. We've made our trek down to the state of Mexico to join a prestigious collection of international colleagues discussing all things insulin potentiated therapy, or IPT, in the treatment of cancer as well as in many other chronic diseases of aging. So I'm super excited to be here to commingle, learn, talk, be with other colleagues in this arena, but also to be able to present you some podcasts on the topic down here in Mexico. So thank you for joining us. When you look at the phrase IPT, insulin potentiated therapy, it's known by many names, and it's important to understand this. It's known by IPT, or insulin potentiated low dose therapy, or IPTLD, low dose chemotherapy, metronomic chemotherapy, low dose metronomic chemotherapy, low dose metronomic chemotherapy with insulin potentiation, which is my favorite. I think it describes it most accurately, that is. Ultra low dose chemotherapy, get that ultra low dose, and then fractionated chemotherapy. Now, why is this important? Because these names, these titles that are given to it, reflect its mechanism of action. And in today's day and time, culture and medicine, there's such a, attempt to malign those items and those therapies that aren't considered mainstream and conventional. But it's actually the evidence that we're following. We don't want to create the end product and then create the evidence to get us there. We want to follow the evidence, because that's really being what a scientist is about. And so I thought, what better way to start this podcast off than basically using what Dr. Donato Garcia described and defined IPT is. Because understand that he is in a long lineage of his grandfather and father who basically initiated this process, and we'll tie it in a future podcast how that brings us into more of a conventional approach. So alternative was there first. He describes it as a bioregenerative medicine procedure that uses a dose of fast-acting insulin as a biological response modifier to induce cell permeability in a controlled manner. And this facilitates the exchange between extra and intracellular fluids. Now, this is important because this is how signals get transmitted. And I've talked about this in vitamin C. I've both talked about it on webinar, on podcasts, but also in lectures. We must get a signal from a therapy into the blood. This is following pharmacokinetics and pharmacodynamics. And we must then get it from the blood, the plasma, actually across the cell membrane, inside the cell, to actually induce changes, affect action. And so facilitating the exchange between extracellular and intracellular fluids is a very important key step here, that the insulin potentiation here of low-dose chemotherapy plays a big role. Its purpose is to allow drugs to enter the cell interior better, reach specific sites to generate a chemical and physiological change, ultimately, and this is key, contributing to the repair of cell function, not the destruction. When you look at the conventional approach to cancer treatment, it's all about destruction. It's going to war on the cancer, and in essence, you're going to war on the body. We've talked about that before. No reason to belabor that point again here. But our goal as physicians, remember the word physician in Hebrew, rophe, means healer, repair cell function. So I think this really definition by Dr. Donato Garcia actually, I think, really ties in well to what we as healers, we as teachers, that is physician and doctor respectively in Hebrew and Latin, what it actually means. So that's kind of a great intro, I think, here at the beautiful state of Mexico and Valle de Bravo. So it's a beautiful place. I think it's a great place to collect and learn. So that's why I wanted to bring you in to learn with us.